Helping people with AIDS find homes can help them find the treatment they need to live with the disease. That's the goal of the Triangle AIDS Network. KFDM's Lauren Huet explains how a grant the Beaumont City Council approved today will allow the network to continue that mission.
Dr. Shannon Schrader is the medical director of the Triangle AIDS Network. He says it's extremely important for people with HIV to take their medication.
If you do not take your medicines at least 95% of the time, preferably 100% of the time, you develop something called resistance to the medications, and they stop working.
But it's tough to get the medication if you're homeless.
If they're out on the streets, not knowing where they're going to live, then they're not going to be coming to their doctor appointments, and they're not going to be taking their medications. So when we can get them to a stable housing, then we can get them back into care.
Kathleen Berryman is the housing coordinator for the Triangle AIDS Network. She says the $144,000 grant will allow the network to continue helping 20 patients with their rent and utilities.
Once we have money to put somebody on our housing program, because it's kind of a small grant, we let them know that they can find a place to live, we can pay their deposit, and we can help them get their lights turned on.
About 35 are on the waiting list for a home that makes it more likely they'll get the treatment they need for HIV.
When you're on treatment, the risk of spreading HIV is much lower. So when somebody's out on the streets not taking medications, then they're possibly spreading HIV to other people.
An outcome the AIDS Network wants to avoid, using grant money to guide patients toward testing and treatment that will allow them to live normal lives. In Beaumont, Lauren Huet, KFDM 6 News.
The AIDS Network tries to help clients find jobs. How much it helps with rent depends on the person's income. The goal is for clients to afford to pay their own rent.